Jerry. How are you from Serenity Medical? Thanks for joining us today. I'm here with Megan Radkin, and Megan is a equine podiatrist. She has her own practice called Radkin Equine Podiatry. Good morning, Megan. How are you doing?
Morning. Good. How are you?
I'm good, thank you. Thanks for
Good.
joining me today.
Yeah.
I want Tell us about your practice. How did you get into podiatry? What made you choose that field?
So I guess I've been interested in hooves ever since I had a laminated course in undergrad and just learned a lot from him. And it just kind of started this obsession. So I went to vet school, spent time with any and every, foot specialist that I could. And when I got out, I did a few years of general practice just to get well-rounded. And then, but the goal was always to split off on my own and do just podiatry.
So that is what you're doing now. And
Yep.
I'm interested in hearing, as you know, we have been connected because of Serenity Medical and our using of CO2. And I'm interested really in knowing from your perspective, what's been your experience using CO2 and what sort of cases have you had the opportunity to use CO2 in?
So I've had two chronic cases. One was about a year and a half post tenotomy, and he was just going downhill. I mean, he had like no blood flow in one foot. So I mean, we did the before venogram and then an after venogram to check the blood flow, and so we did a course of the CO2 treatment in between, and it was just, I mean, it was amazing. Like, it completely turned him around. And then the other one, similar, except it was both feet, and we did that pretty quickly
So,
after I saw him the first time.
can you walk me through it a little bit so we know? You're
Yeah.
very familiar with the subject of laminitis. You're very familiar
Yeah.
as a veterinarian, but most of us aren't. What were some of the things that you noticed, during the treatment time, and give us a little more detail, if you don't mind, of
Yeah.
what your observations were. What was the horse going through, also?
So laminitis is just, inflammation of the attachments between the bone that's in the hoof capsule and the wall of the hoof. And once it, gets inflamed, it can start to rotate backwards, which puts pressure on the bottom, the sole. And that's usually where the pain comes from. So by cutting this tendon that attaches to the bottom of the bone, then you're alleviating that rotation, which
Hmm.
just gives the lamina at the front a chance to heal and become uninflamed. So he had that cutting done about a year and a half prior and was doing pretty
Oh,
good. One foot had pretty much recovered completely. The other foot was just still persistently painful, wasn't growing much, just couldn't get him comfortable no matter what I did.
mm, mm.
So we used the CO2, and I mean, I just noticed that during the treatments, he would, actually stand pretty still for the entire, 20 minutes, which was, unusual for him because usually he'd be shifting back and forth, trying to
Uh-huh.
get comfortable. So that was pretty impressive. And then just, yeah, he just gradually, well, I'd say it maybe took, a week after stopping treatment for him to start showing improvement, but he
Mhm.
definitely started getting more comfortable, started being able to move more, and then essentially grow more foot.
So you mentioned you started to explain something that you had done to test before applying the
Yeah.
CO2 and after. What was that all about? I didn't
So,
quite catch what you were
um,
telling me.
so a venogram is just where we inject a dye into the vessels that go around the foot as a tool to assess, what kind of blood flow there is in there, where the damage is, what mechanics need to be added, that kind of thing. And I mean, he practically had barely anything below the coronary band, so above, the below the top of the hoof wall before the treatments. And then after the treatment, when we repeated it, it was like night and day. Like, it, he actually had perfusion around the entire bone.
So
Um,
what was it that was happening inside the hoof from the CO2? Can you explain?
I mean, from what it sounds like, it's, just the it brings in more oxygen, bringing in more blood
Mhm,
flow.
mhm.
I mean, the foot requires a constant supply of glucose, and that can only get there through blood because it does not have any storage capabilities like the rest of the body. So without blood flow,
Oh,
you don't get anything.
oh, okay.
So I mean, that's always the main goal, is get more blood flow.
So that's exciting. And then, so what do you feel? And you had a good result in this particular case.
Mhm.
Going forward, we're interested in making sure we provide enough information to trainers, veterinarians, owners, and alike on how CO2 therapy could help their horse or their, in this case, we also do canine, as you probably
Yeah.
know. Do you have any advice or suggestions that you could offer as we're trying to educate the marketplace? And obviously, your great success story is really helpful. But coming from you as a veterinarian, is there anything that you could share and offer out to people who might be, interested because their horse is suffering or they've got a particular issue?
Yeah, I mean, I guess I wish I had known about it sooner, because it could have prevented some damage, that did occur because of that lack of blood flow for whatever amount
Mhm.
of time. And so, yeah, if I had, known about it earlier and jumped on it sooner,
Mhm.
that would have been ideal.
Mhm.
But
Yeah, yeah, that's the thing is, and we're really excited because we have a simple device that's easy and portable to use. We have the covers that fit over the different, size of the leg, whether it's a full leg cover, half leg cover. And it's something you can take with you in your truck and take out
mhm.
there to the field with you. Did you treat your horse inside the barn, or were you out in the field when you gave him the treatments?
I actually left it with the client, and I mean, because it's so easy to use, she was able to do them herself, and
Right.
she just did them right there in the stall.
Oh, that's super. That's
Mhm.
great.
Yeah, very convenient for her.
Yes, that's right. And that was hopefully what we would be able, not only, CO2's been around a long, long time, obviously,
Yeah,
hundreds and thousands of years, but uh, giving, the application has been the real challenge.
yeah, yeah,
So we're really pleased that it worked out in your case, and we hope you'll continue to work with us and work with using CO2 on your
yeah.
patients.
Absolutely. Yeah, I plan
Great.
to.
Well, thank you, Megan. Look forward to being able to talk with you again and hope
Yeah.
on one level, don't hope that you don't need it because it'll mean
Yeah.
that your horses are doing
Right.
well. But if you do,
Yeah.
that our CO2 treatment can help you and help your patients to recover.
Yeah, absolutely. Yep.
Good luck in your new equine
Thank you.
practice.
Thank you. I
It,
appreciate it. Thank
it's
you.
hard work.
Yeah, it certainly is. Yeah, it's getting there.
Yeah, good. Well, I'm sure you'll get there. Thank you. It's
Yeah.
really been a pleasure.
Yeah, thank you.